What's up, y'all? It's Calvin here, and I got some crazy info for y'all coming up out of Oregon. There's a whole lot going on. To get right to it, though, there is a hospital down in Bend, Oregon, that is basically rationing out healthcare right now because they're so swamped with COVID patients and they don't have enough people to handle it. They've got room, but they just don't have the manpower. So the governor is calling out 1,500 National Guard members, and they're sending them out amongst 20 different hospitals. All right, but so far there's only a couple of hospitals that are really got any info about them. But I'll start with St. Charles Medical Center down in Bend, and they said in the event of a car crash or a heart attack, hospital leaders say people may not get the care they need as fast as normal. Hospital officials say that, hospital officials said they've already had to postpone or cancel close to 3,000 scheduled surgeries that are necessary for the patients they serve. All right. And these are patients that have cancer, heart disease, neurological disease, surgeries that are necessary to preserve life and function, and they're being delayed right now. And then the doctor goes on to say, so quite simply put, and I don't want to mince my words, we're rationing healthcare. Okay, so that is crystal clear. You know what I'm saying? They get to decide who lives and who dies. And there's an article that I found. You will be able to see it upon your screen. I took a screenshot of it, but I didn't save the doggone link, so I don't have that particular link. But there's a nurse that was talking, and she was saying that the room is not the problem. They've got a lot of room, but they don't have the manpower. All right. And so that was really, really curious because I actually went to go look and see, you know what I'm saying, what their staffing was like. And lo and behold, I was able to find out this right here. As of 4:50 a.m. on August the 20th on 2021, that is today, they have 59 COVID-19 patients, and 12 of those patients are in ICU, with 12 on ventilators. So right there you have 35 COVID patients, because if you add up the 12 and 12, that's 24. Subtract that from 59, then that's 35 people that are not in a dire situation, that's in the ICU, or, you know, saying stuff like that within this particular situation. Not to say that they're not sick and they don't need help. I'm not trying to belittle that point, but, you know, they've called in the National Guard. So you know, so their intensive care unit has 24 beds, as you can see down here, and then they have another 6 at their Redmond location, and that takes them to 30. Okay, so they got 30 beds with 12 people who are in the ICU. And not to sound callous, but for those of you who worked in the hospital, or, you know, have experience with that, people who are on ventilators, they don't really require a whole lot of attention. Like, you can't just walk out on them, like, you know what I'm saying, for hours. But like, it's not the same as the intensive care unit. So for those of you that may not have known that, you know what I'm saying, so like it wouldn't be such a manpower issue with people that were on ventilators, because they're on, you know, they've got a machine breathing for them. You know what I'm saying? They're on autopilot, basically. But anyways, there goes the information with that. You see what the situation is. So let's go on to see how many employees that they have. And if you look here, total, they have 4,482. And of that number, not all of them are doctors and nurses. So there's active medical staff, that's 417, and then they have visiting medical staff, and that is 363. If you add both of those together, that comes out to 780. And in an emergency pandemic type situation, if you divided that by 3, you could roll out 260 fresh bodies every 8 hours. But instead, they've got the National Guard. You know what I'm saying? Because it seems like that many people could deal with the amount of people that they're having COVID issues with. You know what I mean? There's like 59 of them total, and there's 4,000 of them. You know what I'm saying? But we're gonna see what's up with the National Guard and why they're gonna bring them in, because they're gonna say it right here, and it says that the Guard members who are coming from all corners of the state will support the 4 hospital health system in non-clinical roles, including screening patients and visitors at entrances. How is that going to help anything? You know what I'm saying? Running and stocking supplies, I can see how that could help. And preparing and serving food and assisting patients in roles that do not require licensure. All right, we are going to get to that later, because like the National Guard, they have people that do have licensures. They got nurses and doctors and things like that too. But instead, these are the guys that they bring in, you know what I'm saying, to screen people at the door, you know, and go stock things. But all right. So, anyways, there's another hospital that's in Springfield, Oregon. It's near Eugene. For those of you who are familiar with that, that's the that is where the ducks are. You know what I'm saying? So there's another hospital that is having some same issues, and it's called McKinsey, and they actually have a room problem. Their hospital is relatively small. They have 113 beds available, and their intensive care unit is only 16 beds big. And it says right here, there's not much room at the hospital, full stop. And then if you look down here, it says we have most of the ICU beds occupied. All right. And if you look at the date, okay, this is a couple of days ago when this is happening. All right. And they got 16 beds. All right. And when I looked at it in August the 6th, I think it was, they had like 13 patients at that particular time. And here it is a couple of days later. Well, actually, no, from the 6th of August, that would be about a week or so. And they're still not full. You know what I'm saying? So I'm still trying to see the emergency here. But as far as being bogged down, as far as shortage on workers and stuff, if you look here to see how many staff that they have, they've got 113 beds, as I said, and then they have 514 employees. So they're not completely full, and they've gotten adequate staff from their own admission. But the thing about McKinsey, Willamette, that is in Lane County, all right? And if you look right here to see Lane County, and they have a 59% vaccine rate. So most of the people there have vaccines, and now they're having a problem with the COVID-19, all right? And then with Bend, Oregon, that is in Deschutes County. And let me pull this up here. Deschutes County, and you see there, they have a 62% rate of vaccinations. And that's pretty much the same story, like wherever they be saying this stuff at. Like they have a high rate of vaccinations, and that's where people are getting sick. And so this is just more credence to what I was telling you guys, man. Like where they have the explosions with the shot, you have an explosion with COVID. It's because people are shooting themselves up with a disease, man. And folks will try to rationalize this and say that they're getting a weakened state of it or like whatever. But there's a girl in Singapore that took the Pfizer vaccine, and she had a heart attack. So there ain't nothing weak about that. You know what I mean? So whatever they're putting in there, you know, it is not working. And all they had to do was just cut her a check, and that's it. No jail time, no nothing. You know what I mean? And they almost killed that girl. If you look at some of the jobs in the National Guard, they got nurses and, you know, stuff like that. They've got the people that run nurses. They got dental corps. They got veterinarian corps. They've got nurse corps. And that's kind of like the same thing as a charge nurse, you know. They can run floors and things of that nature. But I just got up here on the screen just some of these things. You have a pharmacy specialist. All right. And I'm just going to read the overview. But It says the pharmacy specialist is primarily responsible for preparing and dispensing prescription drugs and medicines while also maintaining pharmacy supplies and records. Okay, so this will be a helpful skill during a pandemic thing. There's a lot of drugs getting issued out and things of that nature. You could bring in the National Guard to do that, right? And something that you need to keep in mind with everything that I'm showing you, even though a person has joined the National Guard and gone to National Guard training, that does not give them a civilian world certification. They still have to go get that. But I am just going to go off of, out of each 10 people that have these medical skills, at least 3 of them have the proper paperwork. You know what I'm saying? So we would just play the low end. And then you've got like a respiratory specialist, and see what they do. Respiratory specialist is primarily responsible for helping with the management of a respiratory unit by administering respiratory therapy and performing pulmonary function tests under the supervision of a physician or nurse anesthetist. Y'all see what that is. The respiratory specialist is strictly an advanced level position, all right? And if you come down here to job duties, if y'all can see that, it says examine and treat emergency or battlefield patients. It seems like that would be somebody that you could have in a situation of like a car wreck or whatever. He's trained for that whole trauma accident type situation, but those aren't the people that you chose to bring to these hospitals. You got people guarding doors, and you know what I mean? And people tend to forget, like, just because you go in there, that doesn't mean they're going to let you out. All right? And I have seen that happen during my day working at the VA, man. Like, I've seen it happen plenty of times. They got this thing called the Walker Act. And if you go in there for any reason and they just want to hold you there, they'll claim the Walker Act and they'll bring in the police if you try to fight or anything like that and just legally keep you there. I saw them keep this one guy. He was in his underwear for like 3 days, man. 3 whole days. He was just there. But okay, so we got the respiratory specialists, and let me see, there was something else that I wanted to see, but you guys basically get the gist of what this whole situation is. You have people within the National Guard that have medical skills that could help these people out, because they say that, they are shorthanded and things of that nature, and they like need this help from the National Guard or whatever, but they don't enlist the people that actually have the skills that they need. It's just muscle, you know what I mean? Just muscle and gunpowder. And I wanted you guys to be able to see this live and direct for yourself, man, and just, make the correlations and dot the I's, cross the T's, and connect everything that needs to be connected, because like, time is ticking, man. Time is ticking, and these people are about to make their move. So I hope that you're paying attention, and I hope that this resonates with you. They are lying to us, like, right in front of our faces. And real quick though, if you check the video out, they show like a whole bunch of different hospitals, like Providence, Emmanuel Medical Center, you know what I'm saying? And these are all hospitals in Portland, but like none of the hospitals that are actually, getting National Guard sent to them, they didn't show any of those hospitals. You know what I mean? And as far as Portland, I know for a fact that the VA is not bogged down and ran over, and we're actually connected by a sky bridge to OHSU, that stands for Oregon Health and Science University, and I know for a fact that they are close to capacity, but they are not there yet, though. But they are getting close. You know what I'm saying? And that's pretty much the same case with the rest of the hospitals in Oregon. Like, nobody's like really in panic mode. So I don't know what these people got going on, that they're trying to send out National Guard and stuff like that. But that's what it is down here, man. And they are straight up rationing out healthcare. You know what I'm saying? So it'd be interesting to see what is going on in you guys' neck of the woods. You know what I'm saying? Feel free to leave comments below. This the Podroast. Shine, sweet freedom, shine your light on me.